Good afternoon, everyone. Myself, Dr. Sugandha Agarwal from the Department of Public Health Dentistry. Will be taking a lecture on oral health promotion. Introduction. Oral disease are important public health problem. They are very prevalent, and their impact on body, society, and the individual are very significant. Pain, disability, and handicap from oral disease are common, and the cost of treatment are a major burden to healthcare system. The cause of dental disease are known and the condition are largely preventable. Furthermore, inequalities in oral health are a problem. However, treatment services dominate all oral health systems. The limitation of the conventional dental health education and treatment services has led to a wider recognition that there is a need to adopt more progressive approach to prevention of oral disease, giving rise to the concept of health promotion mainly to improve the health of the public. Health promotion represents a mediating strategy between the people and their environment, combining personal, social, and personal choice and social responsibility for health to create a healthier future. History, raising cost of medical services begins to turn the attention of government to cost containment. Emphasis came to be placed on health education and promoting self-care. Work of public health pioneers in 19th century, Chadwick and Smith highlighted the need to improve social conditions through municipal reform. In the 1875 Public Health Act to control water supply, sewage disposal, and animal slaughter within the industrial town and cities. 1968 Health Education and Council formed to develop national programs for education for the public. 2000 replaced by health department agencies. Work of Cochrane 1972 in certain aspects, dentistry has been the pioneer in terms of new way of thinking with its long-standing focus on environment, change in the form of water, fluoridation and changing personal behaviors such as diets and oral hygiene to decrease the risk of oral disease. 1974 Mark Lamb, Canadian Minister of Health, published a new perspective on the health of Canadians, which shifted the focus away from an individual biochemical focus to the wider public health agenda. WHO's series of international health promotion conferences facilitated the development and practice of modern health promotion. Ottawa 1986, first of these conferences defined the meaning and potential of health promotion. Now, coming to definition, what is health promotion? It is a process of enabling individuals to increase control over the determinants of health, thereby improve their health. WHO 1984. Combination of education and environmental supports for action and condition of living conducive to health. Need for oral health promotion, limitation of conventional dental health education, failure to acknowledge the complexities of human behavior, failure to recognize the importance of broader social, economic, and environmental factors determining behavioral change, poorly designed, inadequately evaluated, and no theoretical basis. Important elements of health promotion focus on tackling determinants of health causes of the causes, working in the partnership with a range of agencies and sectors, adopting a strategic approach utilizing a complementary range of action to promote the health of the population. Fundamental determinants of oral health care: non-milk expensive sugars, effective control of plaque, optimal exposure to fluoride, appropriate use of good quality and dental care, access alcohol consumption, and smoking behavior. Themes and key areas for health promotion, that is Ottawa chapter, developing personal skills, strengthening community action, reorienting health services, promoting health through public policies, creating a supportive environment. General principle of oral promotion: base action upon a comprehensive need assessments, develop a range of clearly stated and challenging goals, preventing rather than curative approaches like water fluoridation, based upon contemporary theories of individuals' organizational change, a reorientation from prospective to supportive health promotion methods, promote self-esteem and facilitate decision-making skills, control the influence of those interests which produce a profit from ill health, public health rather than individual focused programs, focus on social causes of ill health rather than a victim blaming approach, address the underlying determinants of oral health, tackle causes that are common to a number of chronic disease, common risk or health factor approach, supportive rather than the authoritarian styles of action, a commitment to distribute success equitably, ensure actions are evidence-based, community participation rather than professionally dominated activities, working in partnership with the key group and agencies. Strategic actions required for development of effective health promotion strategies should be based on an appropriate assessment of local needs and resource with clearly stated aims and targets. Common risk approach, effective in long-term and most effective use of the resource. Example, eating unhealthy diet high in fat and sugar and low in fiber causes obesity, diabetes, coronary heart disease, and dental caries. This is a chart which can, by the diet, they can cause this things. Population in high risk or the targeted population strategies, whole population approach, strength, radical, confront the root cause and addresses political and social factors. Powerful, small shift in the population distribution of risk factor may have a large effect on the number of people affected. Appropriately chances the normal behavior of the population to accepted behavior for good health. Limitation, accessibility, to although obvious, may not be acceptable. Feasibility, other pressures in the society may make the changes very hard to bring about. Cost and safety, immediate payment of the cost, but definite, but benefits are more long term. Reducing access to risk factor may adversely affect some people. Higher risk or targeted population approach, more in favor with emphasis on reducing inequalities in health. Example, school fluoride toothpaste and brushing scheme. Strength intervention is appropriate to the individual. Avoid interference with those who are not at special risk. Radially accommodated within the ethos and organization of medical care. Others offers a cost-effective use of resources. Selectively improves the benefit to risk ratio. Limitations, prevention becomes medicalized. Success is only palliative and temporary. Strategy is behaviorally inadequate. Poor ability to predict the future of the individual. Contribution to overall control of this disease is small. Example, hepatitis B vaccination, patient on radiotherapy. This is high risk approach. This is whole risk approach. Different differing approaches to health promotion, preventive top-down approach, behavioral change, educational empowerment, bottom-up approach, and social change. Central concept in whole health promotion, equity, difference in opportunities to be healthy, inequality, actual and measurable differences in health status, empowerment, transfer of responsibility and control over healthy from professional to people, advocacy, advocating politicians, community leaders, and other influential individuals. The role of dentists in oral health promotion. Personal social education aimed at developing life skill. School policy on bullying and violence to create supportive social environments. To ensure safety and security of physical environments. Restrictions on alcohol consumption within school or college premises. Provision of mouthguard accessible and affordable. Links with the health services. Role of government in oral health promotion for the control of caries, development and use of cost-effective mass strategies in nutrition education, advocacy for regulation of food standards, nutrition labeling and advertising, intersectoral coordination, subsidies for primary food industries to encourage the product development consistent with the dietary guidelines. Development of policies, guidelines for dietary practice in government institutions serving food, honest brokerage of the information, development of and participation national research strategy in nutrition, training of health personnel and minimum standard for nutritional knowledge and skill, discourage importation and manufacture of sugar and sugar containing products. Develop an agriculture policy to discourage growing sugar as a major cash crop. Remove all animal sugars from the pediatric medicines, fruit juice, and vitamins preparations. Reduce the level of sugars in the commonly used food made available, more sugar-free foods. Develop a catering policy in schools, large industrial institutions. Introduce an education policy stressing that sugars are nutritionally poor. Control advertising, misleading label and products. For the control of periodontal disease, population strategies, secondary prevention, high-risk strategy, and combined population. Policies areas for oral health promotion of food and health policy to reduce sugar consumption. A community approach to improve body and oral health, hygiene. A smoking cessation policy. A policy on reducing accidents. Policies on water fluoridation. Ensuring access to appropriate preventive dental care. So coming to the conclusion, curative services along with the never successfully alleviate the causes of dental disease. Health promotion offers a new and often complex approach to the improving both general and oral health. The main reason for the dramatic decline in dental care is industrialized countries are related more to the health promotion than to dental services. All preventive measures require economic, social, and political strategies to ensure their acceptance, implementation, and effectiveness. By adopting a health promotion, common risk or health factors approach and integrating oral health with general health policies, policies to promote oral health should become more effective and efficient. Dentists must become team member in advocacy and education with other organizations, government sectors, and with the community organization. Thank you.